course,
Great.
Angela introduced me. I am Jenny Harlan. I am an occupational therapist. I work with the Medicis Home Health Care. I've worked with them 18 years as of last November, so I've been with them a long time. We service Clinton, Cumberland, and Monroe counties, so we do travel. Our Albany-based office. Of course, the Medicis is national, so it's all across the country. I love home health. I felt like that is my calling, where I'm supposed to be. I mean, I feel very blessed to be at my job. I love to be able to have an opportunity to go into the homes and work with patients to help them recover through their illness or injury and get back to doing the things that's important to them. We are very medical model based. We do try to prevent hospitalization, so when we go into the homes, we do a full set of vitals as therapists. We will weigh our patients. We will check their, if they have diabetes, we will look at their blood glucose readings. We also listen to lung sounds because we want our patients to be stable, because they have to be stable before they can really participate in the therapy and improve. So we do a head-to-toe medical assessment before we would do our therapy. And then I also do a head-to-toe evaluation. I look at vision. We look at fall risk. If they have COPD, we're going to monitor their oxygen saturation to make sure we are safe when we're doing the therapy in the home. And then we do an assessment, what's going on with that patient? What is the problem? Is there a problem in bathing? Is there a problem in dressing? Is it just breathing affecting their daily activities? We try to figure out what we need to be doing, what we want to work on. And the most importantly is what the patient wants. You've got to get into the home and see what goals are important to that patient and try to figure out what we are going to be doing to help them based on them and their caregiver. What does that caregiver need us to be able to do? So the caregiver is as important as the patient because they're the expert of that patient, We try to make sure we use activities, that might motivate the patient. There may be adaptations needed. Some patients may have a hip fracture, they may have arthritis. We may try to get them back to where they were, but there are also some degenerative illnesses that we can't get that patient maybe back to where they were, but we've got to try to maintain or keep that patient stable. We also look at adaptive equipment. Sometimes there may be a need for sock aids, reachers, build-up utensils, weighted utensils. Again, we just have to really get in there and assess what can we do or what kind of equipment can we get that patient to be as independent as possible. We also include the caregiver because we want to teach them so when we leave, they're following through what we've set up. Because if we come in and teach and then we leave and there's no follow through, we're not going to be as successful. But we really want to include the caregiver on the home exercises, or if they're helping that patient with the bath, making sure that the patient uses maybe their sponge and they're following what we've set up because we want our goals to be met with the caregiver involved. The caregiver is very important that they take care of themselves. When you're with someone day in and day out, you get frustrated, you might get stressed. It's really good that you get that time and that respite away. Go find something that you want to do. If you have a craft, a hobby, it's really important that you take time for yourself so you will be able to take care of your patient better and less stressed. You all have any questions? Trying to think of anything else.
If someone is interested in a Medicis, how would they go about getting in contact? I'm assuming through the family doctor, or
You have to have a referral through the family doctor. And if you have questions, you can contact Peggy Jones too at the Medicis office in Albany if you're just unsure. But you have to go through your referring physician, and then that physician should fax over the order to home health to initiate care.
and I've noticed too there is a lot of information online about a Medicis, and so that might help someone, I would think.
Yeah, just get a Medicis website and it should give information. We also have speech and physical therapy, so we have a whole team, PT, OT, and speech. And a lot of times when we're getting referrals from maybe Vanderbilt or UK, they're really wanting all three of those disciplines in for that rehab approach. So sometimes they do ask, have you got all three physical, speech, and occupational, because they may want to refer all in at one time. So we do have those. And I think that's all I have.
Well, we thank you very much.
Thank you
and
for having me.